Cool. So yeah, I'm going to be talking about ArcGIS dashboards. So using open source CSVs to populate an ArcGIS dashboard with medical facilities for North Central London. So this is a job my boss gave me about 6 months ago. Yeah. So again, this is what's going to be covered. So what's the question? Basically, could I get CSV data regarding various medical facilities in North Central London into a dashboard on the right? So the data was published by NHS Digital in CSV format that you could download, do some jiggery paper with it, and then chuck it on a ArcGIS dashboard, which you can then access either within the organisation or as a wider public. So the one on the right was one I just literally nicked off the internet to show you what it looks like. But during COVID, there was lots of these dashboards about showing you like where COVID was, allowing you to zoom into different areas of interest and so forth. And then the next question was, can we automate it? And yes, I was able to automate it. So the first time I did it, took me about 2 days to go through the different data and just make it all work. And then after that, I used Python code to automate it, so I could just do it with the click of a button. So this is a program workflow. So again, I'm not going to talk through that. But you can see there's a lot of steps, and again, this is how you get the Python code, just so I could see when it was working and when it was not working. So plus points, it's automated, so that means I can get all the glory for it just by clicking a button. Good chance to brush up my tech skills. I haven't really done this sort of thing before, so I had to learn how to do it and then make it work. It's available forever unless I get the source data, which I have done. And also, they're in the process of getting rid of it. So the last point, modifying it for APIs, the code can be modified. And because I don't own the data, I'm not responsible for the accuracy of it. So if there's any issues with it, I could just pass people to the originator of it. Negative points. Data attributes have to remain the same. Most of the time they do, but sometimes they like to change things. Need to get buy-in from customers. So one of the reasons why I created this was so that instead of people asking, the analysts, how many pharmacies are there in Barnet that do COVID tests, we can give the power back to the user so they can look at the dashboard themselves and then pull the information off themselves. Cost credits. So our model, we use ArcGIS Online and we get 12,000 credits a year. And we had a lot of old stuff on there that we had to delete. ArcGIS isms. So sometimes the software will just not work. I had that actually yesterday when I was trying to do things, and it's just like, nah. A bit of skill played on my part. So again, in my previous life, I was like a middle manager, so I haven't been able to get on my hands on systems that much, so I had to relearn it all. And random character. So one of the data sets, or one of the names of the medical facilities, had like a weird ASCII code, like ASCII code 30, which is an instruction to the computer to do something. So every time we got to that line, it was just like, nah. And every time I tried running it, getting rid of it, I ended up, just ended up crashing it. And I think this would happen because whoever originally did the data probably just copied the name from a website, copy, paste, not realise there's a hidden character there because you can't see it. And right, so I'm going to try and do a demonstration. Sorry, can I drive you? So hopefully this will work. What? Nope. Oh, this is really awkward. I'm allowed to grab my laptop and plug it in.
All right.
Yeah. Right. So I'll put it to
Is ArcGIS spatial software or what is it?
yeah. So, oh wow, that's weird. GIS stands for Geographic Information Systems, which is basically maps and computers. So yeah, ArcGIS is a spatial software.
You have to subscribe to that, or is it free, or?
Cool. So they do free trials for about 21 days, and then you have to start paying for it. The AGOL stuff is free, so as a single user, you could go on there, go online, create your own maps, and then publish them. So last year I was using AGOL for job searching to find out where all the jobs were. Yeah, so about this. This doesn't work now, I'll be really annoyed. Yes, at the moment I'm tweaking it, so that's why it's in the archive folder. Right.
I like that you've got the folder thing given this.
Yeah. Okay. So cool. So North Central London with all the boroughs. So these are all selectable areas, so we can like select them and zoom in. Top right is number of medical facilities. Middle one is GP services, and this one is the pharmacy services. And then this is when I last ran the code, so I ran it this morning. So I'm going to zoom into Barnet. It's a little bit slow, and then facility type. Let's look at how many dentists there are in Barnet. So 55 dentists, and they'll flash up on the map. And then what you can also do is you've got a little arrow there. So you can download the data as a CSV. So if you've done your own selection, you can download it. And then it should, yeah, download it for you. There you go. And then you can open it up and do whatever you want to it. Okay, what we can also do, so it goes down to MSOA level and LSOA level. So what you can also do is say, yeah, I want to find all the asthma clinics that are at GP services. So again, yeah, there's 15 in the area of interest, which is Barnet. And then we can click on one. Click on this we've got here. Yeah, it tells you the name of surgery, location, phone number, website, and so forth. And again, we'll do the same for pharmacy services. So anticoagulant monitoring service. Okay, there's none there. So appointment booking available for consultations, there's 29. Let's see, collect lateral flow device, oh yeah, 60. And yeah, you can tailor it to MSOA level or LSOA level. So the whole point of this, thank you. So the whole point of this was to give power back to the user. So rather than having to like ask me for a certain geographic task and then me sticking it on my to-do list and then forgetting and then giving the wrong thing, they can now do it themselves. There's not an export to JPEG function on this one. That's down to the software, but you can grab a print screen, chuck it into your PowerPoint, and everyone's happy. There was also a layer which had opening times for various facilities. So if opticians was open, it would be green, and if it was closed, it would be red, and that would update itself every 15 minutes or so. But again, with the update of the CSV, that's not working now, so I have to fix that. Or something else. Yeah, so basically by, again, giving power back to the users, that means that me and the guys I work with can then do some other, have more time to do higher end analysis. And it means that, Mr. X, who works, in the office next door, he can, instead of like having to see me for a map, he can just get his own maps. All right, that's it. Are there any questions? Oh. Yeah, that's thank you. Yeah.
We talked before this was about doing room optimization. Does this bit of software have anything like that? So like you can see all the clinics open there. So anyway, to put a room between them.
It's got an extension that we pay for called travel time. So that's what we use. Costs £6,000 a year for 2 licenses. So yeah. ArcGIS can do it, but it's pretty tricky. And I think AGO can do it, but so ArcGIS Online, but yeah, it uses up credits. So cool. Yeah. Sorry, chap in the waistcoat first.
In terms of driving people onto self-serve,
Yeah.
get their own data,
Yeah.
is that go easy, or would you have to, overcome the new barriers? I know where we are driving self-service. You just never really get any traction with it, you know what I mean?
Yeah. So yeah, the biggest issue is user buy-in. So in my previous life, I was in the army, and trying to get buy-in from people to do their own stuff was really difficult. You have to like really sell it to them. So yeah, at the moment we're still going through it, still trying to publicize it, and also just publicize what GIS can do to people, because I was showing someone last week and they didn't even know that we had an analytics function, and she's worked with the NHS for about 15 years. So, cool. Chap in the blue.
It's kind of related, actually. It's how do you want it? Who's using it? What's it?
Yeah, so there's various tools that you can use to see who's viewed it, how many views it's had. So again, at the moment, it's just open up to people inside the organisation. But if we could make it public facing, then we'd have lots more views. And again, it'd be a tool people could use to buy a house. Well, not specific. To look for a suitable house location. Supposing you've got a kid with asthma, you might want a house that's close to an asthma clinic or something like that. Again, I'm not going to say you're going to use this one tool to choose where to buy a house, but it'll just be another tool you can use. Cool. Any other questions? Yeah.
The GP service data, pharmacy service data, are they just national data sets, or is that local?
England wide.
It is.
Yeah. Yeah, but it's weird because they've taken off the links to those sites, but if you know where they are, you can still download them.
Okay.
But I think they're trying to move to an API model instead of CSV model, so sooner or later they'll be taken off completely.